This video is on 2-point discrimination, which can be used as an assessment measure for people who are sensory impaired, and it can also be used as a great post-intervention measure to see what kind of progress they're making. So first off, we like to use a tool called a caliper for this, but you can really use any tool that has 2 points and that has the numbers to measure in between the 2 points. So what's important with 2-point discrimination is that you're varying all of your points across the whole nerve distribution pattern. So say that Erin had carpal tunnel pain, then I'm going to focus most of this testing on her palm, her radial aspect of her palm, because that's where the nerve distribution pattern is going to be. Say Erin has a C6 spinal cord injury level, and her level is at level pain. So then the C6 dermatome is going to be across her palm here on the radial aspect and all the way down here. So I'm going to make sure that I'm testing all the way from up here down here, the distal aspect. So for this test, you want to make sure that the patient has their eyes closed. But to start off, just so she kind of gets an idea of what I'm doing, I'm actually going to use her other side. And I'm going to test an area that I know is more intact. So say I know she has more sensation on her left side. Then, just to give her an idea of what this is going to be like, I'm going to make sure that I press into her skin so that it indents with enough pressure. So you see the indentation when you press. And you want to make sure that the 2 points are hitting at the same time for maximal benefit. So with your eyes open, just so you kind of get an idea. So was that 1 or 2 points?
2.
Good.
1.
Okay. Obviously, since her eyes are open, it's kind of cheating. But just so she gets an idea. And it's also really good to get a baseline on that other side with her eyes closed. But for the purposes of this, we're going to test her impaired side, which is going to be all of this here. So go ahead and close your eyes. I'm going to start at 5 millimeters, which is generally the recommended for your palm area and your
Forearm.
Forearm, thank you. My goodness. Okay, so starting at 5, I'm going to make sure I'm varying the points across the whole distribution and asking her 1 or 2. So 1 or 2.
2.
1 or 2.
1.
1 or 2.
2.
1 or 2.
1.
1 or 2.
2.
1 or 2.
1.
Okay. Generally, when she's questioning it, or if they're getting them wrong on consecutive trials, you're going to move it up. So I'm going to move it from 5 millimeters to 6 millimeters.
2.
Good.
1. 2. 1. 1. 1.
Okay, she's guessing again, so I'm going to go up to 7.
1. 1. 2. 1. 2. 1. 2. 1.
Good. She's getting it right again, so I'm going to go down.
2. 1. 2. 1. 2. 2. 2. 1.
Good. So if you feel like they can do better, keep going down. Essentially what you want to do
1.
is make sure they're getting it right 75% of the time,
2.
and that'll be your baseline.
1. 2. 1, 2.
Okay, good. So I'm going to stop there because that was about 75% of the time. And like I said, you just go up if they're getting it wrong or seem like they're guessing, or if they're doing a good job, and you can keep going down. The goal is to get the smallest measurement. So she's at 5. I would record 5, get a norm on her other side to compare it to, and then use that for post-intervention.